My interviewee is Dr. Heng, who is a family physician at Easy Family Clinic, serving the Yunus community for about 20 years. My reason for choosing him is that he's very empathetic and passionate about medicine, and his purpose is to help people get well physically and mentally.
I am Dr. Heng, and I'm a family physician for the last, I think, close to 20 years. Been in the Yunus community, I think at least it's 18 years of my 24 years of medical career. When I first graduated and started working, there's a lot of fear because you just graduated and you have all this knowledge where you have to learn to apply, and that's why there's such a thing called internship. They make sure that you know how to use the knowledge appropriately, confidently, and it's through the internship that you gain lots of guidance and directions and so on by the specialists and your colleagues to help you cope with the demands of a doctor in the hospital, because the internship training is all in the hospital. After 1 year of internship, and if you do well, then they promote you to become a medical officer, and then you continue your career from then. You know, like when you sell food and then people come to your store and you eat, and say, oh, you know, they're so great, they're so happy, and you see them eat your food and they're happy, right? So same thing, I mean, when you treat them and they get well, you know, and that's the purpose of my job, is to make sure that they come to me with a medical problem and I sort it out for them, and then they get better. That is already a gratifying experience for me now. So these cards generally, I mean, sometimes they give cards, sometimes they buy gifts and so on. But yep, I don't really pursue and chase for those kind of things. So, but I feel extremely happy if I can solve their medical problems, and that's the main thing. There are some cases I can't even help them, but they're still very grateful because I guide them. You may not be able to help them cure the problem, but at least you guide them in this noisy environment. You know, in the medical thing, they don't know what to do, right? So you show them the way, and then and through that way they find you know, the way, the appropriate treatment that they can go for. When patients die, or when patients suddenly suffer a lot because of the sickness, it does get to you. We are after all human, you know. Breaking sad news, or you know, telling them, oh, I'm sorry, I found that you actually have cancer. Then I think it's okay to shed the tears. Okay, you know, I think we are after all human, and we just be with the patient. You don't have to say a lot. Sometimes just tell them, and then just be there for them. And you know, we also see patients who are dying, and then they come and visit you, say hello for the last time and say goodbye. You know, there are those sad cases, and yeah, we'll sometimes just like friends, you just chat with them and recall the happy times. Don't focus on the sad times. Quite happy times, and then as a family physician, you know the whole family, so you can also talk to them and ask them how their other members of family and how they're taking to it, and see whether you can pick up any of the relatives that are not coping well and so on. And you can give them some encouragement and so on. It's not only about listening here, but also to treat the family as well as a whole.